Okay, I'm going to review patient movement and geriatrics using the PowerPoint notes and a few of my own questions. So, what do you need for an SRD? A doctor's order. Before you get a doctor's order, what two things must happen? The least restrictive restraint and the documented need for safety. Okay, what are reasons for restraints? Client safety. When are SRDs renewed? Every 24 hours. What complications can occur from SRDs? Poor circulation and injury. What are alternatives to SRDs? Having a family member sit with them or putting them close to the nurse's station. How often do you check patients wearing SRDs? Every 30 minutes to an hour. What do you check once removed? And what do you need to put it back on? Distal circulation of extremities, and you must have a doctor's order to put it back on. So when do you remove the SRD? Every 2 hours. Why do you remove the SRDs? To perform range of motion exercises and to toilet. Okay. What would you use the supine position for? Procedures. What is supine? Flat. What is low Fowler's? 30-degree angle. And why do you use it? Dyspnea. You use all of them for dyspnea. But what is semi-Fowler's? 45 to 60-degree angle. What is high Fowler's? 90-degree angle. What is the word for lying with top knee flexed for enema or perineal assessment? Sims. What do you call lying on the stomach for position or pressure point relief? Prone. What can occur to the circulatory system if you're lying in bed too long? Thrombus formation, blood clots. When pertaining to the pulmonary system, what can occur if you're lying in bed too long? Pneumonia. What can happen to the kidney if you're lying in bed too long? Renal calculi or kidney stones. What can happen to the skin if you're laying in the bed too long? Pressure ulcers. What can happen to the GI tract if you're lying in the bed too long? Or what results? Constipation. What can happen to the musculoskeletal system if you're lying in bed too long? Contractures and atrophy of muscles. Okay. What can you use for the patient that's lying in bed too long when trying to prevent complications of the circulatory system? TED hoses and SCDs and range of motion exercises. You're going to prevent clots. What can you do to help the person with pulmonary complications? Deep breathing and coughing and repositioning. What can you encourage a person with kidney stones to do? Drink fluids, 8 ounces every 2 hours. What can you do for pressure ulcers? Reposition every 2 hours. What can you do for constipation? Increase dietary fiber. Increase dietary fiber. Okay, what is shearing? Tissue layers slide on each other. Okay, who is at risk for pressure injuries? If you mentioned anybody that's chronically ill, debilitated, older, incontinent, spinal cord injuries, immobility, incontinence, or poor nutrition, you got it right. What exactly happens with pressure ulcers? Like, why does the ulcer form? The collapsed blood flow. Okay, what stage of ulcers am I describing? Non-blanching, erythema. Stage 1. Okay. Full thickness with extensive damage to muscle, bone, or supporting structures. Stage 4. Full thickness with necrosis of subcutaneous tissues. Stage 3. Full thickness with the wound base covered by slough or eschar. Unstageable or stage 5. Okay. What type of beds are these? Like, what type of bed am I describing? No, tell me what this bed is made of. That's what you can do. What is a clinitron bed? It's a sand bed. What is a flexiflow bed? It has air pouches, inflating and deflating rotating pressure. And an egg crate bed is a soft bed, a foam bed. That's it for that part. Okay. What happens to the hair of the elderly patient? Thins and balds. What happens to the nails? They become thicker. What happens to the skin? Less collagen and elasticity. What does fat do? Decreases, creating wrinkles. What's another term for age spots? Lentigo. What happens to sweat and oil glands? They decrease. What happens to vessels? They become fragile. And what happens to hormones? They decrease. What happens to bone mass? It decreases. So basically everything decreases and slows down. Just keep that in mind. I'm going to switch the questions up a little bit. How much bone mass do women lose? 30%. Okay. How much bone mass do men lose? 10%. What is it called when bones are porous and brittle, fracturing easily? Osteoporosis. What is kyphosis? I would say humpback, but the correct definition is compression of intervertebral disc resulting in postural changes. Why is this happening? Because of decreased mineralization of bones. So we know there's muscle weakness and joint movement limitations. How can we improve these things in the elder adult? Mild exercise programs, good body mechanics. What can decreased peristalsis lead to? Constipation. What can decreased muscle tone of sphincters lead to? GERD or incontinence. GERD with the food coming back up, or incontinence because they can't hold it. What can occur with tooth loss or dental caries? I'm going to say malnutrition because they can't really eat. Okay. What can decreased kidney function lead to? Kidney stones. What can decreased bladder capacity lead to? Frequent urination. We went through this. What can an increased prostate gland lead to? The urge to pee and can't. I'm just going to switch over to my questions. Wait. Why are the elderly at risk for diabetes mellitus? Because there's a decreased beta cell production of insulin. What is ACTH? Adrenocorticotropic hormone. Do you know what this is for? Actually, no. Why? I just gave you the answer. Hold on, wait. Okay, with the decrease in adrenocorticotropic hormone, what can result in the elderly? What can you see in the elderly? A slow reaction. It's a pituitary hormone that regulates the adrenal glands. The whole fight or flight thing. Okay. Which state of development